Well, thank you for staying tuned. It is still the conversation on Lagos television. It is World Immunization Week, and we'll be looking at the theme for the year is Immunization for All is Humanly Possible. Now, today we explore the importance of immunization, the barriers to vaccine uptake, and how we can all work together towards a future where no child is left behind in immunization. Now, joining the conversation, we have some people here with us in the studio. So, ladies first. Let me start with Pharmacist Laitan Adeniyi. She's the Child Health and Immunization Specialist, Save the Children International. You're welcome.
Thank you very much.
We also have here, she is in-house Kikelomo Oduyebo. She is a journalist and a digital content creator. Joining us also is Akinpelu Adetola. He is the Immunization Coordinator, Lagos State Primary Healthcare Board. You're welcome.
Thank you very much.
And Dr. Ayodele Renner. He is a consultant pediatrician, aka constituency leader for all constituency members. If you get it, you get it. You're welcome.
Thank you, Joy, for having us.
Yeah. So let's start with you, Pharmacist. Looking at the theme for the year, and then looking at the global health landscape, and the theme, immunization for all is humanly possible. What does this mean?
Okay, thank you very much. So, immunization for all is humanly possible. It's actually an effort, a collaborative effort to ensure that everyone, every eligible children have access to immunization vaccines to prevent any vaccine preventable disease. You know, Nigeria currently we have about 2.2 million children under immunized, and this is about, we stand the place of the second position in the world as the country with the highest number of under-immunized and zero-dose children. So I think this is a call to action for everybody to collaborate and join hands together, the government, the stakeholders, all stakeholders, community, the traditional and religious stakeholders to come together, join effort together in ensuring that every child who is eligible, all children are actually eligible, have access to vaccines, and actually they are also prevented from any diseases that can actually come in at any time. Thank you.
Now, let me come to you, Dr. Renner. Now, she has just said something, that there's a high number of under-immunized children. So what are the benefits of immunization, and then what are the risks of not, taking your child for immunization?
The benefits of immunization, I'm not sure we have enough time to cover the entire multitude of the benefits that immunizations have for children, but I just say that immunization prevents children from disability and death. And people always think about the idea that if you are preventing vaccine preventable diseases, you are preventing death, but that's not only the situation. Sometimes it actually prevents disability as well, because some children who end up surviving some of these vaccine preventable diseases might actually end up with disabilities like difficulty with movements, hearing loss, hearing difficulties, and so this impacts the financial and even the psychological framework of the parents and the society at large. And so it prevents death and disability. Vaccines actually also prevent other children from getting these diseases, such that when you have a large number or proportion of the population being vaccinated against diseases, then the likelihood that you will encounter someone that has that disease is significantly diminished. And it means that children are unlikely to come across people who will give them these infections. Now, when it comes to vaccines and vaccine preventable diseases, coverage in Nigeria actually can be better, and yeah, of course there are some factors that have led towards this situation, including ignorance, including these challenges with misinformation and disinformation, which I think we would try to address in this discussion.
Okay, let me come to you now. So what are the efforts, or what efforts is the Lagos State Primary Healthcare Board taking towards ensuring that people, especially at the grassroots, are open to taking their children for immunization? Because one problem is hesitancy. I have come across a woman who has 3 children, and she has never taken her children for vaccination. I tried to educate her, but she didn't buy into it anyway. But so what is the government doing towards this?
Thank you very much, Joy. So we've looked at it on 2 different ends. There's the demand, which is even people willing to take the vaccine. But on the other hand, there's also the supply. Is there an enabling environment for these vaccines to be delivered? So we looked at two options. First, to even, if there's a demand, for the demand to be answered, there must be the supply side. And on the supply side, what the government has done is to ensure that for every ward in the state, at least there's a primary health care center. And apart from having a primary health care center, we've taken it even further. Using the human-centered design, we need to understand what the people want. It goes beyond just creating a place for them to take the vaccines. Is it even convenient for them? Because we've seen places in Lagos State where the distance is not so much, but the cost of coming there is quite a lot. So we've designed outreach services to get to the most underserved, the hard to reach, the far communities. And we're not just designing these outreach services at the convenience of the healthcare workers. It's designed with the communities. When is most convenient for you? When would the mothers, the caregivers be available to bring these children for vaccines? We have communities like in Koshofe local government where these mothers typically during the day will not be available. We've designed evening vaccination sessions so that we can address those kind of communities. We have people where we vaccinate on Saturdays and Sundays because during the week they are not at home. So we decided not to just create the infrastructure, but also to create it in such a way that we take into cognizance what is important for the people. To even break down this hesitancy, one of the major barriers is the fact that we've always looked at immunization as a female-driven activity. When men bring their children for vaccination, it seems strange, both from the side of the healthcare worker, even the mothers is like an imposter within that gathering.
It seems like it's a women affair.
It's a women affair. So we have a program called Fathers for Health. It was an initiative that we started last year where we're involving men in immunization. They drive the activity, they push in the communities, they talk to mothers, they take children. They are also within men that have children within this immunization range. So they also lead by example by being the ones to take their children to the healthcare facilities. And at that point, they also serve to pass a message to both the mothers and to other caregivers that it's not a mother affair. It's a family affair. Both male, both female, you can drive this as a whole. Of course, we also look at the part of the healthcare workers because it's difficult for you to point fingers without some pointing back at you. And one of the things we've also, in our interaction with the community, is the fact that they will say, oh, healthcare worker attitude, the healthcare facility, they were wasting time because time is precious. So these are things we are addressing, employing healthcare workers to ensure that we do not have that gap. It's difficult, yes, because people will continue to either retire or move on for one reason or the other. But one thing the government is very particular about is exit replacements. You must replace whoever has moved on for whatever reason. For every new facility you set up, you must staff it. So you employ new people to cover those gaps. So the government has been constantly employing to replace this. And apart from employing, we're also training. In fact, at times we wonder if, with the amount of times we need to train, if they actually have time to deliver these services. But then we know that the right attitude and the right knowledge would go a very long way. So these are just little steps that we've been putting in place as government to ensure that everybody is captured. No child, for any reason, be it location, be it finance.
Even in the riverine areas?
Oh, especially. So we have a special focus for these hard-to-reach areas, especially our riverine areas. There are places in Lagos where to access them, it roughly would cost about 50 to 60,000 naira going by boat. But the onus is on us as a government to ensure that vaccines and other healthcare services, especially that is provided at the primary healthcare level, is delivered to these communities at no cost to them, because they are already cut out due to location. You don't want to raise extra barriers, bringing in cost and things like that. So the government takes special concern, special care. And fortunately, we've been fortunate to have partners also support the government with funding these activities, because it is a lot of money. In all honesty, it's a lot of money. So the government plays its own role. Partners also come in, they look at these gaps where the government cannot fill totally, and they also support as much as possible.
You've answered a lot of my questions. Fantastic. Right, let me come to you, Kikelomo, now. Despite the level of awareness, but we still have hesitancy as one factor or a challenge. So how can media professionals now collaborate with healthcare workers to amplify immunization efforts?
Thank you, Joy. I think that this is one of the biggest efforts we can do, which is putting information out there to let people be aware that we have child killer diseases out there, and that if we do not vaccinate our children, we will lose them to death or we lose them to diseases. If you go to some parts of the north, I served in the north, polio is rampant there. Imagine if those children were vaccinated against polio. How the lives of those children would have been better off, instead of begging on the streets of Lagos or on the streets of Kano or on the streets of any parts in the country. Their life will be better. I'm speaking as a mother, and I'm also speaking as a journalist. We need to keep demystifying that myth that if you get vaccine, you would have some form of, there are a group of people and individuals who are having international backings against vaccination. We as media need to keep speaking out to say that the vaccines are safe. I mean, I have a 5-year-old daughter, and from birth, I was given the Fox vitamin A after 8 days. And after that, this is her immunization card. I mean, she just completed this when she turned 5. The only thing I was omitted in the primary healthcare center is the Rota 1 and Rota 2. I wish that, thank God that the primary healthcare board person is represented there. I'm sure you take the message back to Dr. Ibrahim that in the private sector, I registered in a private facility and Rota was given there because she incidentally had mumps. I didn't even know. I just woke up one day and I saw all her ears swollen. I was afraid. It was a Sunday morning and I had to rush out to the hospital. They couldn't handle it there. I went back to Ayike, so where I gave back to her and they explained to me. So if she had gotten Rota, that could have been prevented. So I'm hoping that the primary health centers would look into it and bring back Rota 1 and Rota 2 into the, I know that immunization is free.
But Rota, you have to buy it.
But Rota, you have to buy.
So
So
it's
if
actually
it's,
for them,
it's something, the
It is
conversation
actually
that
now
we can-
in our routine.
It's available, yes.
It's not even
As in
available.
for real, I want to take
Yes.
for her, for instance, because she eventually had mumps.
She has gone
because
past.
She has gone past
She has
the
gone
age.
She has gone back, so there's nothing we can do. So media, we need to put the information there. We need to avoid disinformation. We need to avoid the misinformation. Our community mobilizers need to engage the community because that's where we have the hard to reach people. That's where we have the underdosed children and also those that missed. Some started immunization, but they didn't finish it. They just got tired. I mean, there were times that I couldn't go for the immunization based on the dates that are recorded here. But I ensure that the days that were not convenient, I just make up. So we keep making up. And the primary health center, like he said, are just around us within the communities. Even if you Google, now I know that we have, it's been mapped on GIS. So you
maps,
just Google if you don't know a primary center around you. With Google, It tells you where it
In
is.
fact, in Lagos State,
Yes, and
every
you can
local
locate it.
government,
Yes,
yeah,
some
primary
people
health.
may say, I don't know where it is. Just Google and you'll get it.
All right, Dr.
And it's
Renner,
free.
I would like you to address misconceptions, myths about vaccines. And in fact, Akinpelu said something. He said they have evening vaccinations. I used to think that vaccines only in the morning before the sun comes out.
Before the sun comes out.
So I'd like you to address some misconceptions.
Okay, so myths and misconceptions, I think I'd like to use a practical example. So I had the opportunity of working with the Primary Healthcare Board on a particular project. The HPV vaccine was being rolled out, and unfortunately, it was met with a lot of resistance. As a matter of fact, it was met with a lot of hostility because there was a lot of misinformation going around about the rollout of the vaccine. So they wondered, why our girls? Why 9 to 14 years? Are you trying to make them infertile? Are you trying to promote promiscuity? So there were a lot of misconceptions about the vaccine and how people had come down with strange side effects. But at the end of the day, when it comes down to the facts of the matter, all of these misconceptions are false, and this misinformation is disinformation. The HPV vaccine does not cause infertility. It does not cause girls to become promiscuous, as people allude or assert. And this is just one example. And so we had to create a video in which we were telling them and encouraging them to actually go and take this vaccine because it was safe and it is effective in preventing cervical cancer. And that's just one vaccine as an example. Now, the other vaccines, things like the polio vaccine, things like the measles vaccine, the same sort of information spreads around, such that some mothers might say that, oh, it was after I got a vaccination that my child started having certain symptoms, maybe fever. And so fever is a natural event that occurs after a lot of vaccines. But it might discourage some mothers from going to go and get the vaccine because they feel like, I don't want to be battling with a fever after my child has gotten the vaccine. And so we need to begin to actually tell parents to say that, look, at the end of the day, these are the expected things that you should can occur after a vaccine, whether it's a little bit of swelling at the site where the vaccine was given or a little bit of fever, so that they are not caught unawares. And then when the event now happens, they will now say, they'll tell their neighbor, and that's how it spreads. That's, don't go and take that vaccine because when I took it, my baby had a fever, and they will discourage one another from going to go and get these vaccines. And so I think the idea of continuously making sure that parents get the right information about vaccines can help to combat misinformation and disinformation around vaccines.
All right, let me come to you, Pharmacist. Now,
Yeah.
what role does community engagement play in achieving immunization goals? And then how have you been able to achieve that? And then the roles of traditional leaders, religious leaders, because we are very religious people in this side of the world. And we tend to listen to our pastors, our imams. So how can they also contribute towards the fight of this?
Thank you very much. So for community leaders, you just mentioned that in this part of the climate, we are very religious, and we have this high regard for community stakeholders. And, because of the power that the reverence that population give to them, they serve as a key voice in ensuring that there is increase in demand for vaccination. That's why for all immunization activities, you see that there are key stakeholders that needs to be engaged. I like the point where Dr. Akinpelu had mentioned that human-centered design. It's a collaborative effort to ensure that community leaders are also involved, religious stakeholders, such that when you go to the mosque, you hear the same message that you are getting in the church. Even the traditional birth attendants, everybody gives the same message. And also the leaders of the communities, your estate leaders, they are also available to give the same message. And also at the time when there is supplementary immunization activities, where there are campaigns, they also engage with the communities to allow their children to be vaccinated. So it's they help to lend a voice. They give that platform to allow people, health workers, to be able to assess the community members, and also to ensure that the people in the community also go to the health facilities to also take vaccinations. We've seen situations where you see a community leader tell a community member that, I know you just gave birth, this is the next time. They would even be the ones to follow up on the vaccine schedule for the mother to ensure that everybody in the community is protected, because they know that once a child comes down with an infectious disease, it can spread. So everybody wants to be protected. So they play a very key role when it comes to ensuring that the community is safe.
Can you tell us more about the GSK Boost project and its impact?
Yeah, thank you. So the GSK Boost project, that's a better opportunity for optimizing immunization services, and we are targeting 0-dose and under-immunized children in Nigeria. Currently, it's being implemented in Kano and Lagos State, the reason is just because of the high number of under-immunized and 0-dose children in these two locations. So we've actually looked at some of the barriers to having or people having to take immunization, or reasons why they actually don't complete it. And together with key stakeholders, the government stakeholders, the religious leaders have actually designed strategies to be able to increase the uptake. You bear me witness, a lot of people are aware of immunization services, but the problem still lies in increase in uptake, demand for immunization services. So the essence now is, okay, how do we ensure that we close this gap? And then one of the things the Boost project is trying to do is to ensure that people in the hard-to-reach areas have access to these vaccines. So part of the strategy is to go on support the outreach services to ensure that health workers, if people feel that the health facility is a bit distant for them to attend and get vaccinated, health workers can actually go in there, create a temporary or a makeshift post, vaccinate children within that environment, within that community, and ensure that everybody is covered at every time. So the Boost project is looking at that, and also to support the community and traditional systems, the structure, to create demand. It's not about awareness now. Everybody is, a good number of people are aware of vaccines, benefit of vaccines and immunization. Unfortunately, because of the misinformation that is also out there, to also bring out messages that would help give correct messages on immunization. Also, part of the things we are also trying to do is to empower health workers in partnership with the government to ensure that they give this empathetic vaccine communication. When mothers come in, they have concerns, and being the people they relate with, they can actually address their concerns when it comes to vaccine issues. And then lastly, we are also looking at improving the political and governance platform, the financing environment, to be able to advocate to the government to finance immunization services. From the Abuja Declaration, government is committed to having about 15% of the budget towards healthcare, but you bear me witness that that commitment does not stand. Unfortunately, if at the federal level this does not stand, then also at the state level, hardly will you see such, and even at the local government. So the Boost project is actually also looking at strengthening that system to be able to advocate for more funding when it comes to immunization services, so that health workers can actually carry on whatever activities they need to do. Thank you.
All right. Dr. Akinpelu, as member of Immunization Program Coordinator for the Lagos State Primary Healthcare Board, how do you track immunization progress in Lagos State?
Thank you very much. So we have this, we are doing two systems. We have our paper-based system and we have our digital system. For the paper-based, immunization services has a flow of records. It comes from the healthcare facilities to the local government to the states. Fortunately, we also have a DHIS2 system, which is a national platform where every data is entered into. So we look at data on the national platform. We look at what we have at the paper level.
Is it that there's always something they feel when
there's this big ledger that you see them writing, at the facility. So that ledger translates into another ledger at the local government, and it translates to another document at the states. So we have documents on every child vaccinated in the states. What we also do is we look at these documents, we look at the expected population in those areas. So if we're expecting that in, say, Ikeja local government, based on what we've gotten from the National Population Council, telling us that there are about 5,000 children, and we're seeing that you vaccinated only 3,000. That tells us that there's a gap that needs to be filled. So the next step is what we call our defaulter tracking. We now send people into the communities, our community health officers. They start liaising with the community leaders. Who in your community is yet to be vaccinated? Are there children that have been given birth to? Let's start following up on them. We go through these registers that we've also written to start tracking who has come for this vaccine and has not come for the next vaccine. We pull those data, we take their phone numbers, we start to call them, we take their addresses, we send it to the community leaders to try and help us track them. For some, it's probably that they've moved to another area within the states. We can always follow them up to where they've moved to. We have, and Lagos is also a huge transit state. Lots of people are going, lots of people are coming in. Although there are more coming in than going, so that creates even more burden, because when you plan, at times what you meet is a bit more than what you've planned for. So, but with our data, we've been able to triangulate which area has more transit persons, so we plan better for them, which area has more people moving out of, more people moving into. We have a dashboard where we look at our data, we visualize everything that is happening within the immunization space, and we know, okay, this is where there's issues, these are where we have more unvaccinated children. Then we go to those communities to find out, why are we having your children not come for vaccination? That's where we now start having the community engagement. Then we design an intervention that would suit that particular community to solve that problem.
All right, Kikelomo, let me come to you. Now, what the role of schools, in pushing out the need or the importance for vaccine education? Because when you pass this information to the children, they can be crusaders to their parents.
One of the things I like about the Primary Healthcare Board is they make these infographics and they send it around. I mean, I have seen a few on some platforms and I've also shared. So schools can also belong to some of these platforms where they share with parents. I know that in my daughter's school, once there's an immunization coming on, they would send a little bit of information to say, has your daughter or your son been vaccinated? Yes or no? If no, do you want your child to be vaccinated? If it's vitamin A or the first dose or the second dose, they would usually say. So in those cases, it is important for schools. Some schools will just close their gates. They will not allow the team from the Primary Healthcare Board to enter into their school to get children vaccinated. I think it's a wrong thing. I think that it's important to have a collaboration, ongoing collaboration. If we know that we're vaccinating for next week, a week or two earlier, the Primary Healthcare Board should engage the schools, especially through the associations, the principal association, the teachers, NUT associations, so that the parents, teachers forum, so they know the importance. If we're vaccinating for next time, it's a new term now. If there's a vaccination coming on, immunization coming on, the parents should be aware so that children can be presented as at when due, including churches too. I know that there are churches that they open their doors, mosques, they open their doors for all the mobilization thing to come in and do the vaccination. So if you do not open your doors, there's little or nothing that can be done. And it's also important to tell children, we're vaccinating tomorrow. Please tell your parents, just like school fees. Children are very, tell your parents to come and pay your school fees. They would never forget. Mommy, have you paid my school fees? So the same thing goes for immunization. We should carry the children along so that they know the importance that if you are vaccinated against measles, I have a friend who was blinded because of measles, yes. So imagine measles being in the immunization routine and such a child had been vaccinated earlier,
prevented
it
it.
could have prevented that needless
this
virus.
needs to be-
Yeah, I mean, just a very interesting point on the subject of schools. I think, again, the schools kind of don't really want that responsibility of having to deal with a child that comes down with the side effects from a vaccine, you know, so that maybe they are a bit worried that this child is under my responsibility and under my care. So if the healthcare workers come around and then give the child a vaccine and maybe there's a side effect, we just don't want to have to deal with the parents. So I think that the Parents Forum, the Parent Teachers Forum is very important to let the parents know that we are coming around and these vaccinations are going to be given to your children, whether it's the oral polio vaccine or whatever. And I think they're also a bit concerned about consent. So they always talk about, oh, nobody's going to vaccinate your child without without your consent. And I think that should be emphasized, that nobody's going to grab a child and vaccinate them without the parents having given their consent already. That being said, I wanted to just correct something very briefly. So actually, the rotavirus vaccine doesn't prevent mumps, actually. Yes, so it prevents diarrhea from rotavirus. So what prevents mumps is actually the measles, mumps, and rubella vaccine, which unfortunately is not yet in the national programs. Available in Nigeria, but it's not on the national program yet because it's a bit pricey, it's a bit expensive, and so we've just not put it on our program yet. But hopefully, with great people like Lagos State Healthcare Board, maybe we might have the MMR vaccine, you know. Yes, I must also mention that the MMR vaccine does not cause autism, because that's another huge misconception, yes, that the MMR vaccine causes autism. It does not. None of the vaccines cause autism. So,
talking about vaccines, I just want you to, educate people again. How important is it to start early? I know that once a child is born, BCG is very important, so I need you to, educate.
Okay, so the vaccine schedule will differ depending on where you find yourself, and I'm sure there are some people watching us from the diaspora, which I find very interesting, because in the diaspora, they won't give the BCG in the UK or in the US because BCG protects against tuberculosis, and tuberculosis is something that they don't have as a public health problem in those places. And so I find out that some children who are born abroad, when they come to Nigeria, we still have to give them the BCG, because if they're going to be living here in Nigeria, you don't know who you're working with, who is in the bus that might actually have tuberculosis. You think that cough is just a cough, but no, it might actually be tuberculosis. So the immunization schedule starts from birth, and then it goes on to 6 weeks, then 10 weeks, then 14 weeks, and then we vaccinate against diseases like polio, meningitis, diarrhea from rotavirus, diphtheria, which of course we had an outbreak of, quite recently, and it goes all the way from birth to 9 months, and of course it must be tracked. And thank you, Kikelomo, for bringing the immunization card. Yes, it has to be tracked so that we know who has gotten what at what point in time. And you see, the issue of vaccine and vaccine preventable diseases is so serious that sometimes, if we confirm that a child has come down with a vaccine preventable disease, then we have to give drugs to not only the child, but to the adults in the house that the child has come in contact with, because those adults too can actually contract that disease, because their immunity to that disease has waned significantly, and adults can get diphtheria and die from diphtheria. So if you see a child that has had diphtheria, we must actually also treat close adult contacts, like the parents, like children that the child has come in close contact with, to make sure that they too don't succumb to that particular condition. And so I'd say that, we can't go, it would be difficult for us to go through the whole vaccine schedule from start to finish, but I just say that it
stops at age 5.
So it stops at age 5 based on the vitamin A.
So age 9 now.
Age 9 now.
HPV.
So age 9 with HPV.
Okay,
So
HPV.
HPV now. Yeah, so HPV now with age 9. So children.
HPV is for girls.
For girls.
For now.
Age 9 is for girls.
For now.
For now, it's for girls. So age 9 to 14. So it actually stops at 9 now, which has been included in the national program. So the hope is that parents will take advantage of this, because these vaccines, while people say that, we can't get them for free, there's really no free lunch in Freetown. Somebody is paying for it. The government, in addition to, and in collaboration with international and national partners, are paying for these vaccines. So to see them go to waste, and it's a huge and monumental undertaking to actually get these vaccines from manufacturing into the arms of these children, because there is a cold chain whereby the vaccine needs to be preserved at a very specific temperature to make sure that by the time they are getting to the children, they are still as effective as they were when they left the manufacturers. So please, people, let me look inside the camera, take advantage, my constituency people, take a vaccine today.
I'd like you to address those who are still hesitant, about vaccination. I'd like you to lend a word of advice to them.
Okay, yeah. So Just to add to what Dr. Ryan said, vaccine does not cause diseases, does not cause, because that's a very strong misconception that's been going on. And we need to understand that the aftermath of not getting vaccinated is it far ways, outweighs the initial emotional blackmail that we are trying to give ourselves. So I think that at this point, with information that keeps going out every time, we should understand that vaccines are beneficial to us, and parents, caregivers should actually embrace this. Yes, there might be some adverse events following immunization, especially with the injectable vaccines, but we should understand that these things are common. Most caregivers, when they see this, they just feel that it was my child got sick because this child took this, but these are normal processes that are bound to occur, and they actually usually resolve on their own within a couple of days. These adverse events following immunization resolve on their own. So it's nothing to fear. Vaccines are safe, they are available, they are free, and we should actually embrace this opportunity. Thank you.
Dr. Akinpelu, just finally, what's the future of immunization for us here in Lagos and Nigeria as well?
For Lagos and for Nigeria, because as a state, we would always align with national policies. We are going even further, because just as Dr. Renner was talking about the MMR, I was just about to let him know that we'll be introducing the measles rubella this year.
Oh, that's great.
And
Wow.
so we are moving forward. I'm sure in some states they've introduced the malaria vaccine. So there's a lot in play over the couple of years. The immunization space is growing bigger. We're getting more access to these vaccines, and the sky is the limit. That's just the way to put it. We're hopeful that sometimes along the line we'll be able to also introduce the HPV for boys, so that we know that we're covering everybody as they should be. But we should be rest assured that as a government, both at the state level and at the national level, everything is being put in place to ensure that vaccines are not only available, but are available at the right condition to be delivered at the right potency, so that every child is protected.
Interesting and educative conversation we've had here, talking about immunization for all is humanly possible, and that's the theme for the World Immunization Week. Thank you so much, Pharmacist Laitan Adeniyi. She's the Child Health and Immunization Specialist, Save the Children International. Thank you for your time.
Thank you.
Also,
My
Dr.
pleasure.
Akinpelu Adetola, Immunization Program Coordinator, Lagos State Primary Healthcare Board. Thank you for your time.
Thank you.
And Kikelomo Oduyebo, journalist and digital content creator. Thank you.
Thank you for having
And
us.
Dr. Ayodele Renner, consultant, pediatrician. Thank you so much for your time.
Very many
And I
thanks.
hope that you have learned a thing or two, even more than two things here that has been discussed here on the show. The conversation continues after this. Stay with us.